Good morning. Today at the World Implant Expo, I'm here with Dr. Chandrasekhar. Good morning, Doctor.
Thank you.
Doctor, would you like to introduce yourself?
Yeah, I'm Dr. Chandrasekhar, a prosthodontist from Hyderabad. I did my graduation from a government dental college, Andhra. Then I went on to do my master's in prosthodontics in Manipal University. But my main implant training happened under AAD Maxi course. I'm very lucky to be the first batch of AAD Maxi course way back in 2003. So that's how I'm here to say in the galaxy of those speakers across the world. So the AAD Maxi course has given me a good amount of a platform where I could improve myself and become a part of it.
Yes, Doctor. Doctor, how do you stay up to date with all the new technologies in dentistry?
Yeah, as you know, with this evolving part of the dentistry, you tend to see a lot of innovations which have come upon. Like if I look at myself, way back in 2008 when we started implantology, where the patient used to complain a lot about procedural wise. But as things moved on, I could see that the newer tools, technologies, whatever we have adopted, it made the patients at ease and the comfort, and people started using implants daily. For example, guided surgeries, and today for me in my practice we use a dynamic navigation where the field of vision is on the monitor rather than in the patient's mouth, and the entire vision is seen on a monitor, so you have a broader vision of what you are doing it and the accurate placement of the implant. So this is how the technology is, and you can see and you can witness among the speakers which they have shared today and last 2 days at World Implant Expo, that whatever the newer things which have come to avoid complications, to manage failures into success. So these are all those updation you really need to do every day, because as you know, it's all like a learning curve. There is nothing which is going to end in this evolving mode of implantology. So that's how it is.
So what do you think about the current education system here?
Current
education system, sir?
Just to say, if you look at the education system, what we have done before, where the amount of practical knowledge was meagerly less, and as it started moving into the good amount of innovations and all, people started working with good amount of a practical knowledge now. But to say, earlier the number of for example, in terms of implant dentistry courses, there used to be a courses where it is like a 2 to 4 days implant program, and then people used to learn with a meagerly a less amount of a knowledge. So when they went on to do a implant placement, they started placing implants, no doubt about it, but the restorative quality of those implants have always been a little less quality. When you compare with courses which offer an modules type over a period of time, for example AAD Maxi course, where we were taught, mentored by some of the finest speakers across the world who had enormous knowledge. It's not about only theoretical knowledge, even practical knowledge, and even at those times we were taught lasers, hot tissue lasers and all those things. So if you tend to learn something, you need to learn from someone great, someone good in all those things. It's not like people who have done 5-6 years of experience and all. So you should establish yourself where there is a course which is being mentored by some of the good speakers with good amount of a credibility, then you would learn more. So I would suggest the dentists, especially the budding dentists who want to come into the implantology department, they have to go through these courses, and few times online webinars like how DentistChannel.Online is doing. They can have sitting at home rather than just browsing a phone. It's better that you watch those webinars, and then when you come to a clinical practice, you try to apply at least few of them, and then share those knowledge with your fellow colleagues, so that you can have an interaction between your colleagues and then improve your knowledge. So the point one is, try to gain knowledge or do courses from a well-established courses, from the credibility of the speakers who are worldwide, and then keep updating yourself with the newer technology, newer innovations, whatever is happening. Always keep updated. It's like you should know what is happening now. You can't be like a frog in the well, isn't it? So you feel like as if I know everything in the well, but when you come out of the well, you know that there is something happening more. So people should understand, attend all these conferences, especially these conferences where you tend to see what is happening outside. So then you will learn things much better.
So would you like to tell us on how you manage everyday complications in your clinic?
Yeah, to start with this particular question, I go on to say that in 2006, I actually started my own lab called as Precise Dental Lab. Then I went on to go on with the practice. But in the laboratory, being myself an implantologist, all the doctors, they used to send those implant cases for the prosthetic rehabilitation. But then I used to realize that the prosthetic complications out of those surgical failures, the way they used to place, most of the topics are on restorative catastrophe. Things that almost majority of the implants were either misaligned or badly in a shape, and then we used to hellbreak our mind to give solutions for them. So my idea here is, if you can do a good amount of a diagnosis, see, whatever we have been taught during our courses, it is like start from the beginning, where those basic principles of your CAS, understanding the models, CBCT, placing virtual teeth, and then go on doing your placing of such implants in those relations, then prosthetically it becomes easy. If you see in my laboratory, most of the cases are like how to provide a remedy for this particular case. It's not like a straightforward case, like how we show in a textbook or on internet. It's not like that. It's completely different from what we look at it, because whatever we see here are good cases, but in actuality, those cases don't go well. So these doctors, without any mindset, without any pre-planning, actually pre-surgical planning, they tend to place implants and cause a lot of failures. So that particular thing, I want to make it sure. And now, after so many years, we have few clients whom we made to understand this is how you are supposed to plan, this is how you are supposed to have a sequence of events, sequence of steps you follow while placing implant, so it goes well. And all those, we are happy to say that all those doctors are very happy, to work along with us, and now those cases are little streamlined.
Thank you so much, doctor. Thank you for your time.